the role of antenatal ultrasound in the diagnosis of congenital anomalies. So basically, ultrasound is the first line of investigation for diagnosing congenital or antenatal anomalies in the fetus. And why is this so? This is because it's easily available, it's less expensive, there is no risk of radiation to the fetus, and it is a non-invasive method. So there should be some standards when you do antenatal or obstetric ultrasound examinations. Who sets these standards? These standards are set by a few institutes of repute, like the American Institute of Ultrasound in Medicine, or the ACR, the ACOG, or the ISUOG, that is the International Society of Ultrasonography in Obstetrics and Gynecology. What are the prerequisites for anybody who is doing an antenatal ultrasound scan? The operator has to be experienced. The equipment should be of high resolution such that you can pick up the anomalies easily. And then there should be an amount of reproducibility. That is, if two different people are doing an ultrasound, they should come to a common consensus. Then a strict methodology should be followed as to what part has to be examined and where to take the measurements and how to take the measurements. And for this, it requires educational courses. So what is the aim of antenatal ultrasound? The aim is to basically survey the uterus and the maternal pelvic organs. And then if there's pregnancy, you need to date the pregnancy and assess fetal growth, and also the main thing is surveying the fetal anatomy. So what are the timings of an antenatal scan? So early pregnancy, earlier on when the lady is 5 or 6 weeks pregnant, they can come in for a confirmation, or they can come in with some pain or any symptoms. So that is an early pregnancy scan for confirmation of pregnancy. So the scans which are most important for diagnosing anomalies are two. The first is at 11 to 14 weeks of gestation, where you do the NT scan or the nuchal translucency scan. And the other is 18 to 20 weeks of gestation, where you do the TIFA scan, that is targeted imaging for fetal anomalies. After that, at 32 weeks, you can do a scan for general assessment of growth, and as and when required in third trimester, if suppose the fetus has IUGR or something, to follow the fetus up and look for the growth assessment of the fetus. So what are the risk factors for fetal anomalies? The risk factors are an increasing maternal age, an age more than 35 years, or if there is a previous history of a fetus or a child with chromosomal abnormality, a family history of genetic disorders, if the mother is on any medications like anti-epileptics, or maternal systemic disorders like diabetes and hypothyroidism.